Hello, hello. Yes, good evening. Can you hear me? Yes, that was because there was some error. That's why confirming before we really start. Is it okay? Can you hear me properly? Yeah, can you hear me? Yes, good evening. Can you hear me? All right, it's clear. Okay, fine. Thank you. Sure, sure. Okay, fine. Let's start. So, welcome to session 17, and this is the arterial system, right? Actually, actually pretty artistic. And before we really start, the official disclaimer, right? Very much needed. All right. Right. So images displayed during this medical training session, they are for educational purpose only. And definitely, yes, all images, they are suitable for only medical students. They are not at all suitable for audience of all ages. And all the images which are displayed, explained, they are for medical education and address mature audience. Right. Yeah, I am good. Absolutely fine. So after that half marathon, right? And I was very happy. Means I could finish it in sub 2, that is under 2 hours. All right. So let's start with our today's topic, right? Now this is actually so interesting, right? You'll find that such a marvelous artwork by God. So I just give you brief that how exactly we shall be approaching, because in a single session, right, we shall be talking about the entire arterial system of head and neck, brain, circle of Willis, all the branches, everything, right, and we'll go parallel with the entire dissection. So that's how we shall approach. Now first I brief you that what exactly, as per our every time the way we are doing, we'll start from heart, right, and today we'll be focusing only on arteries. Tomorrow we'll be focusing only on venous system, right? Okay, so from left ventricle, this is like arch of aorta, right? On the right side and the left side, things are a bit different, because this is what is called as the brachiocephalic trunk, correct? Brachiocephalic trunk, and from there goes the common carotid artery, and then this thing is what is called as the subclavian artery, right? Over here, this common carotid artery will go by itself. Means it is straight branch from the arch, right? This is arch of aorta. And over here it is subclavian artery. So this is what is there for left and this is what is there for right. But that's it. This is the only difference, because from this point onwards things are all good, right? They are same. Okay, so we change color. Our approach would be first over here, this subclavian artery, right? It will be giving all those small branches, right? We'll see all of them, but we shall be concerned with more one, what is called as the vertebral artery, because this vertebral artery will be going from the posterior side. It will enter into the skull, because its function is to supply blood to the brain. Over here, common carotid, once again it will be divided into internal and external, right? And this internal will travel all the way, and that will also reach to the skull, and that is where both of them will form what's called as the circle of Willis, right? Meantime, in between there will be there'll be several branches, several structures will be coming. We'll see all of them. What else? This external carotid artery, right? This will be taking care of the external part, that is face or in the exterior of the cranium. So we'll be taking care of this also. So that's it. This is how our entire approach would be, right? So if I really write it like that, starting with subclavian, then our focus will go on to this vertebral, then then to common carotid, and in that process we'll first be dealing with internal carotid, right? And then finally we'll be going for external carotid, right? At the end of the session, I'll show you a very easy method of remembering it. It's like how do we really draw, and you'll be able to recollect every figure because there are dozens and dozens of images, right? Again, all of them, they are real images, so that would make things much better. All right, so let's start with our first portion. Here it is. We are dealing with neck, right? So we have removed some of the structures. Which structures, right? Say for example, the biggest muscle, right? Sternocleidomastoid. Now we can write sternocleidomastoid as just SCM, right? Sternocleidomastoid, that has been removed. This is artery. Yes, so definitely veins should not disturb us today. So we shall be removing, we have already removed veins. So this is internal jugular vein. We have removed that also, correct? And then the moment you see this, immediately you figure out that those infrahyoid muscles, right? That is that omohyoid and sternohyoid. So even they are also removed. So it is like, so sorry, infra, and we just write H, right? Hyoid. So they have been removed. Once they are removed, right? So this would be like their location, right? Say this internal jugular vein, that would be over here, right? Just for our understanding. Then what about the sternocleido? That is so always like cross, right? That is how the sternocleidomastoid is there. And those infrahyoid we saw, right? So they are all removed and the platform is ready. So let's see. Now in this, the moment we try to dig deep, right? So what really happens is, it is what is called as the, say, superior thoracic aperture, right? Through which we are watching, right? We are watching down, and what we are watching, this one, right? That is subclavian, right? So through that aperture, we are watching. This is subclavian artery. So this is like clavicle, right? Yes, like every time, right? That orientation would be very much necessary, right? Okay, and here there would be like rib number one, right? Rib number one. So that is the superior thoracic aperture, and through that we are watching that subclavian artery, and then immediately next to it, right, we are watching over here, and that is common carotid artery, right? Otherwise rest of the things, so they are very obvious. This is like, say, trachea, right? And then this gland right over here, it could be none other but it is like thyroid gland, right? So things are good this much, right? One important muscle which we should have talked about, this muscle, this muscle, right? It is the scalenus anterior, right? So that is scalenus anterior, and that's how things really go, right? Let's move further. Okay, so this is nothing much, but it's like a close-up, right? This is close-up. In fact, it is the same image, but this is bit zoomed version, because now we don't want to have a look at other things. We want to just focus on one, that is subclavian. Now, say subclavian artery. There are all the chances that at times we start forgetting, because as such, if you see, you have to remember so much. So how to remember these branches of subclavian artery? There are so many mnemonics, all, but something which is so easy to remember, right? We'll remember it like vitamin, right? VIT is vitamin C and vitamin D. This is how we'll remember. And which muscle will be responsible for that? This scalenus anterior, right? Now over here, this section, this first one is before scalenus anterior, right? It is before scalenus anterior. So here it is, our prime, this is vertebral, right? This is the artery for which we have been waiting for such a long time, because this will be the main artery. Can we see it? No, we can't see it, right? It is a bit deeper. We need to cut down some of the vessels. We need to cut down few of the structures, no problems. But what else can be seen? Well, over here we just see that, see, few vessels. This is subclavian, right? In case if, or let's write like over here, subclavian artery, right? This one is common carotid artery. So that's how they are there. Now see, this vertebral is one. The second one is internal thoracic, something which is going down, this one, right? So this is internal thoracic. We shall not be talking about it now much because it is related to thorax, right? So we just say that is internal thoracic. So this is internal thoracic, and that's it. Story of internal thoracic is over. This is T is thyrocervical trunk. Now whenever the word trunk comes, that means from that point onwards, from that point so many other arteries will be coming out. Same thing happened, brachiocephalic trunk. So it means it gave that subclavian and common carotid, right? Such trunks would be appearing today at many of the places. So the moment trunk comes, be ready that there will be 2-3 branches which will be coming out. So over here also from sorry, from thyrocervical trunk, the first thing first, we said, "Arey, this is thyroid, right? Thyroid. So let's give one branch to thyroid, right? So that becomes easy. So here it is. This is inferior thyroid artery, right? So that's one. All of them, they are of thyrocervical. So where is thyrocervical? We'll just point like this. This one is thyrocervical, right? That is the thyrocervical. Okay, so that is thyrocervical. From thyrocervical, those branches, they are coming. First one, which is going up, that is inferior thyroid. One which is going over here, right? This one all the way. So this is transverse cervical. No confusion. This one and then the second one, right? Again, they both are going similar. This is suprascapular, right? So this is suprascapular. Okay. Now all of them, right? This suprascapular, they are all related to upper limb. So that's it. Their names have come, and now we'll be continuing with our journey. So that was thyrocervical trunk giving inferior thyroid, transverse cervical, and the suprascapular artery. Meantime, say as we are talking about subclavian, so we need to finish that, right? This subclavian artery. So what about this C? C is costocervical. Right? C is costocervical, and D is dorsal scapular, right? Which will be going posteriorly. All right. So these are the branches of subclavian. Now to see it bit properly, we need to cut the thyrocervical trunk, right? So once we cut the thyrocervical, immediately we'll be able to see the most important vertebral, right? And now you know where the thyrocervical is. So here was the thyrocervical, correct? TC, and we have cut it, correct? So I like thyrocervical. cervical trunk, and that's what we cut, right? And this is what you see. That one is vertebral artery, right? This one is vertebral, because vertebral will be playing a super fantastic role into the blood supply of brain, right? So this is common carotid artery, and this is the thyroid gland, right? Many a times I'll keep on writing few of the branches again and again, so that by the time when we finish the session, it is like you are crystal clear with the topic, right? You remember it like a second nature. You don't have to struggle for it. Okay, now let's orient ourselves, right? This is neck, right? No problems about it. This one is what? This is common carotid artery. This one is what? This is vertebral artery. This is scalenus anterior, right? All very good. Now this common carotid artery, as it is going up, it is dividing into two parts, right? It is dividing into two parts. One part which is thicker, right? This one, right? This is internal carotid artery, right? This is internal carotid, right? Obviously artery, because today we are talking about arteries only. And this one is external carotid artery, right? This is external. This external, it is going to harass us, right? But that's why we'll be talking about it at the end. It will be giving so many branches, literally like an explosion, right? But we have got the easier method to remember it. No problem. And in fact, we'll watch all the branches. So here it is, the shape itself, right? That is so smart. This is thyroid cartilage, no doubt about it. The moment the thyroid cartilage is in our hand, immediately below this is nothing but the larynx, right? That is the larynx. And if that is the larynx, so then all the way that tube, it has to be trachea, right? It has to be trachea. All right, done. And this shape itself is telling that, yes, it is shouting that I am clavicle, right? So now let's move up. Common carotid artery, right? It is going up and it is dividing just below at the angle of mandible, right? So that is like the angle of mandible. Just keep it in mind, right? Angle of mandible. That is where it is dividing. Okay, like a close-up, right? Over here, say as such, you remember this when it goes, right? There would be parotid gland, right? This is like, see, the parotid gland is there. So we need to cut it, right? Parotid gland. So we need to remove it. We'll do that. At the same time, that ramus of mandible, that also will cut, right? So ramus mandible, that's what we'll cut. And as we cut, yes, see, now things are much better, right? We can see so many things. So this is that carotid sinus, right? We have talked about it, that baroreceptor, that is the carotid sinus, right? Now see, there is one very interesting variation. Normally, say when the division, even in books or even when you'll see in so many of the diagrams, you'll find that, okay, it is shown like this, that this is common carotid, right? That's how that internal carotid and this is external carotid, they go it like this, simple, seedha sada. Now see, there is, at times there are variations. Say over here, this is a variation. So normally it goes straight up, but over here it has taken a slight turn and then it started traveling up, right? So this is like a normal variation, nothing bad about it, right? But this is internal carotid artery, right? Normally it would go straight. And this carotid sinus, yes, do remember that it is at bifurcation, right? It is at bifurcation. And this is normally. Still a zoomed version. So over here, see, we have cut we have cut the external carotid artery and all of its branches, right? See, this was the external carotid, right? So this external carotid artery plus branches, they have been removed, right? Because we now want to focus on, say, internal carotid artery, right? Because internal carotid artery will be supplying brain, while external carotid artery will be doing what? It will be taking care of scalp, dura, and the head, except the orbit, right? So head outside, right, minus orbit, right, and plus the scalp and the dura. And as we clear the structures, right, here, in order to reach to this point, what we need to remove? We need to remove that digastric, right, posterior belly of digastric, because now you know it so well that posterior belly of digastric, sternocleidomastoid, right, they are the muscles which are always staying over there on the lateral side. So we need to remove if we really want to see it proper. So here, say digastric, right, posterior belly, right, because anterior belly, to it's completely into different plane. So posterior belly, that's what we have removed, right? Plus there would be styloid process. So we have removed styloid process plus the muscles associated with it. In other words, we have cleaned that area where we really see this internal carotid, right? This is the internal carotid. Now see, internal carotid is so focused. Internal carotid is not giving any branch, right? It is simply just traveling all the way, right? Where would it really reach? Here it is. You remember we said one thing, that those foramen, right? Bony foramen, that is one, but when it comes to dura, right? The entire scheme changes, right? Now today, again, we'll see that. So over here, this is our internal carotid artery. Meantime, if you are wondering what exactly is this, who was here, right? That was the place for internal jugular vein, which has been removed, right? So that is internal jugular. Now let's see the bony foramen. Bony. From where? Now we know that this internal carotid artery enters into the skull via carotid canal, right? So carotid canal, it is very easy to identify, because see, this is what? This is the styloid process, right? See, this is styloid process, right? We are looking at the base of the skull, right? So that is the styloid process, and that's what it is, the carotid canal, right? Now this canal, as the artery will be going inside, right? This is base skull, right? This is base skull. At any point, if there is any problem in orientation, let me know immediately. Now listen carefully. Carotid canal will be traveling upwards and medially. Correct? It makes sense, right? Because if you remember, we said that, see, this carotid, internal carotid, how we saw that in before two three sessions, we lifted that optic chiasma, and then yes, there was internal carotid, right? We lifted that optic chiasma. So it means this has to go towards medial. So that's why we said that this carotid canal will be directed, right? It would be directed medially. So that is done, right? That is done. This is fine. We understood that. And upwards, obviously, right? It is coming from the thorax, right? It has to go up. So upwards. So that's how it will go. So now we draw the direction that this carotid canal will go in this direction, right? That's how it will go. Now we go inside the skull, right? So we just think it like this is the skull, and we rotate, and then we see it from top. Okay, right. So this is base skull, right? So this is base skull. This is like anterior cranial fossa, right? This one is the middle cranial fossa. All good. So that carotid canal, right, which was going towards the medial side, that means that one will be coming over here like this. Why over here? Because this is the foramen, right? Right now, this is without dura mater. Once the dura will come, everything will be covered, right? This is all good, right? See, this is foramen lacerum, that would be superior orbital fissure, this would be foramen rotundum, this would be foramen ovale, right? All good. So this one is a lacerated, right, with ridges. This is foramen lacerum, right? This is foramen lacerum. So we talked about this. That other end of the carotid canal, that is foramen lacerum, right, which is very rough. And outside it is very cleanly defined. So this is inside skull, right? This is inside skull. Well, till this point, it was not very romantic, right? Now see what happens. Here comes the dura, right? The moment dura comes, the entire picture would change, right? So many interesting things will come up. So this is like what is in the real body or the living body. First thing which we figure out, that this middle cranial fossa, right, there is dura and everything, and none of the foramen is seen. So we need to cut this dura, right? That's what we cut. The moment we cut, all the familiar structures will start appearing, right? We'll start identifying them, right? Yes, correct. This is all-time favorite, right? That is trigeminal ganglion, right? So this is trigeminal ganglia. So that is good. And from trigeminal ganglia, right, all those three divisions, they were going, right? What that is for the ophthalmic part, maxillary, the mandibular, and lovingly we were calling CNV1, CNV2, and CNV3, right? That's how we used to call. And to be very specific, this was going via superior orbital fissure, right? This was going via that round foramen, and it was called as foramen rotundum. And this mandibular was going via oval foramen, so it was called as foramen ovale, right? This was ovale, and this was rotundum, right? So this trigeminal ganglia. But now we are not interested in this also, so we remove this trigeminal ganglia. Any guessworks? Where exactly are we planning to land? We are landing into, if you have said cavernous sinus, that's the precise answer. Very right, right? Anyway, still it is there. Meantime, see over here, those three cranial nerves. Three cranial nerves, they can be seen, right? 3, 4, and 6, right? All going for superior orbital fissure, right? Oculomotor, trochlear, and abduction, right? All of them going for supply to those orbital muscles. And we said that yes, it is very easy to remember, right? It was SO4, superior oblique 4, LR6, lateral rectus is by 6, and rest of all of them, they are supplied by 3, correct? So 3 would be supplying what? So say there were 4 rectus. So superior rectus, inferior rectus, medial rectus, lateral rectus, it has come. Then there are 2 obliques, right? Superior oblique has come, so inferior oblique. And plus, don't forget levator palpebrae superioris. So done, right? Done. All muscles are done. So here it is, right? This one is 3rd, this one is 4th, and this one is 6th, right? Okay. So we remove them also, right? Yeah, this is just like a good close-up, right? Trigeminal ganglion, 3, 4, 6, all of them they are seen. So you use it for your practice, right? So now it's removed, right? All those structures have gone. So that's our internal carotid artery. And this artery is sitting into, because it came from lacerum, right? And now it is into this space. So because we have cut the dura, this actual thing, this one, is cavernous sinus. Tomorrow, when we'll be watching these sinuses, right, we'll see that how beautifully they are arranged. Right? So between the layer of properly packed in the dura layer, right, these are the sinuses, and then they all meet, different names, and that's how they take care of it. So much so that you'll find that even the CSF absorption, that would also be there. Right? We'll see that tomorrow. But here it is into that venous blood, right, outside. This internal carotid is sitting inside, right, this internal carotid which came from foramen lacerum, right, and it is over here. Now what we are doing is that this is still, right, we are watching, but actually so it is packed. So this will be going underneath the bone, right? So it is now from this point, it would take a turn. It would take a turn, right? It takes turn. Where is it planning to go? Well, okay, we go back to that bone again. Just orient yourself that what exactly are you watching, right? The easiest structures first, something which is instantly identifiable. This one, right? See this one, the shape, yeah, that is anterior clinoid process, right? So this is anterior clinoid process. That it will go underneath, and then it is at this point, at this point it will come out from below, right? So over here it will come out. So internal carotid artery comes out here, right? You can say near this anterior clinoid process. Now as it comes out, right, once again, say this is middle cranial fossa, right, just for the reference. This is what, this one would be optic canal, right, optic canal through which two structures were passing, one optic nerve, and then we said that one more artery, that is ophthalmic artery, right, ophthalmic artery, okay. And then there was the superior orbital fissure, right, superior orbital fissure. Then this is what, that is foramen rotundum, right, and then still if you go below, so then there would be foramen ovale. So that's how we just orient ourselves, right? See, this is so cleanly seen over here, here, this one over here. This is what shape itself, anterior clinoid process, right? Perfect. Okay. Now see this. This is just one concept which you have to understand. And first, orient yourself that what are you watching. What you are watching is that, see, this middle cranial fossa we have already say removed, right? That dura. This is, there was like optic tract, right? Then they were forming what? They were forming optic chiasma, and then via optic chiasma there was the optic nerve, right? So this was optic chiasma, these were optic track and then the optic nerve, right? That was what was going. Just below optic nerve, there was internal carotid artery, and that was the reason that in that one of the our session we said that we just lifted that optic chiasma and right, and we found that yes, internal carotid artery was over here. Now this is where actually it is. This one, right, that is internal carotid artery. This above is the optic nerve, and via internal carotid artery, from internal carotid artery, because this is where it pierces dura and it emerges beneath optic nerve, right? Very important point, right? Pierces dura and appears beneath or under, but beneath is more precise, beneath optic nerve, right? And over here it will give one branch, and that branch is, and this is that branch, and that branch is artery ophthalmic artery. So that's the thing, right? It is this ophthalmic artery which is given, and then it will go to optic tract along with optic nerve, right? It will go to that optic foramen or optic canal along with optic nerve, right? Optic tract is here. So, and that's how it will travel. So this is the one, right? This is ophthalmic artery, which is a branch of internal carotid artery. Yes. See, this is what we have done. We removed optic nerve, right? Optic nerve removed. Then we scraped off some of the dura also. Now, can you see how nice big this internal carotid artery, this is, this big structure, this entire structure, the tube which is coming out, this one is internal carotid artery. But deep within, can you see one structure, right? See over here, I'll outline it first and then I'll zoom it. See, and then I remove this. See this one, that is ophthalmic artery, right? Because it runs in optic canal with optic nerve, right? So this is ophthalmic artery, the branch of internal carotid, right? So we have removed this optic nerve and dura. Otherwise, on the opposite side, see the optic nerve is here, right? So that's why we just can't see that emergence of ophthalmic artery, right? So that is also optic nerve, opposite side. Now, for proper understanding, as we said, that this internal carotid arteries, right, that the last part over here, this is like just over there for the optic chiasma, right? So this is for your understanding. Middle cranial fossa and dura is intact, right? That's what I was telling you, right? This is internal carotid artery. Over here, because the latex has been filled to make it more prominent. But this one is optic chiasma, right? The shape, looks itself is enough to diagnose, right? So that's their relation. That's how they are arranged. Okay. Now we'll see. Now see, this is like episode, right? So over here, our internal carotid artery has successfully reached the destination, right? So it has reached to the interior of the skull. Now let's call another one, and then the whole mission would start inside the skull, right? So vertebral, sorry. So now it is the turn of vertebral artery, right? Let's call vertebral artery. Internal carotid artery has reached successfully. So we go back, right? And this was the point, right? This was where we saw that from subclavian artery, this is what is emerging, right? So that one is subclavian artery and this one is vertebral. Right? Just at the root of the neck, it has started. Again, to see this, we need to clear some of the areas. So we mercilessly removed almost all the muscles of the neck. Right? We have to remove neck muscles. We have to remove even those tissues which are around the vertebra so that it can properly be seen. Because see, for all those upper 6 cervical vertebra, right, it would be traveling into that foramen transversarium, right? The foramen which is there, which is the classical identity of the cervical vertebra. So it will start traveling into that, right? So that was the body, and over here, say, right, bifid spine, and then over here, right, from the transverse process, there was foramen transversarium. Via this, it will travel, right? So here it is, we can see that yes, this is going in, and here it emerges out, right? That's the vertebral artery, and here it is the vertebral artery. So it goes posteriorly and then it starts traveling. At the top, right, at the top, say over here into atlas, right, this is the artery over here, right? It takes turn, right? It took the turn. So that's what happens at the highest level, right? And see what happens. Now it has started traveling medially and backwards, right? So from both the sides, it has to enter into the skull, right? So it is traveling. So this is the vertebral artery, right? It is traveling medially and backwards or the posteriorly. Right? So that's how it is going. Over here, it will pass through that between atlas and occipital. There was atlanto-occipital membrane, dura mater, right? It will pass through them just below the foramen magnum, right? So over here, and we'll see this thing. So it will pass through, right? Atlanto-occipital membrane and dura. Right? Let's see this. To see this thing, right, if we really want to see it very properly, we need to cut the skull and we have to watch it from inside, right? We have to watch it from inside. So let's say if we put the cut over here, right, so that it is sliced. So here it is, the top portion, right, that has been removed, and we'll now watch it from this point, right? We'll watch it from the top, and this is what we see. Here it is. Nice, right? This is the top view. This is the top view. And this one is vertebral artery, right, from both the sides. And this one is what? This one is foramen magnum, right? So foramen magnum, and that's the dura. It has just pierced the dura and it has come out. Now these vertebrae, they join together to form what's called as the basilar artery. Basilar artery, right? So both vertebral arteries, they join, right? And once they join, where are they landing? Now to we know it so confidently that this is occiput, and the occiput, portion of occiput which is in front of the foramen magnum, there is only one name, and that is basi occiput. bus. So that would be the landing station for basilar artery, right? It runs on the, because it comes from the, say, foramen magnum, both of them they join, and then it starts traveling forward, correct? Because this is the skull, right? This is the skull. Those artery, they came like this, and then that is via foramen magnum it has appeared, and then it starts traveling, right? So actually the whole thing is getting formed at the base of the brain, right? On top of it there is brain. So right now we have removed the brain. This is happening just underneath the brain, right? We'll see even that also. So this is just at the basic occiput it starts. Now as it proceeds further, here it is, right? See, for the orientation, what we have done so far, right? We have done that this one is internal carotid artery, that is good, and this one is basilar, right? And this one is vertebral, right? Both of them. And with this we add something, right? What we do, we just add, right? This is there, right? Optic chiasm and everything. We just add all the branches, right? It looks like a dancing man, right? As if he's dancing. So this is like, see, we have added. This is the internal carotid artery for the reference. This one is the basilar for the reference, right? Rest all are newcomers, all new branches. We have not yet talked about it. So let's pick one by one, starting with internal carotid. So where is internal carotid? Well, as it emerges out, right? Here it is. As it emerges out, this is internal carotid artery. This internal carotid artery will give one branch, right? So that branch is going anteriorly. So this one is changing color. This one is anterior cerebral, right? It is cerebral artery, anterior cerebral artery. Fine. Internal carotid artery would continue as, right? It would continue itself as, so that's why I'm keeping same color. It will continue as, and that one is middle cerebral artery. So far so good. It gives one branch. Can you see a small branch which is going over there, right? Because it is branch, so we take another color. This is the artery which I'm talking about, a branch which is going over there. This is posterior communicating artery. Oh, if it is posterior communicating, so there has to be something like anterior communicating artery, right? We'll see that. But yes, it is there, right? So far so good, right? So same thing is happening on the opposite side. That's the internal carotid artery, right? And it is giving branch anterior cerebral artery, and this one is the middle cerebral artery, right? So that so far that has really, that much has happened. Okay. Optic chiasma is over here, correct? Optic chiasma, this one. So from both the sides, here and here, these two anterior cerebral artery, right? We'll write C for cerebral, right? Because there will be C for cerebral, right? When it will come cerebellar, so we'll write CL as cerebellar, right? And when it would be communicating, so now we'll write CO as the communicating branches, right? So that way there won't be any confusion. So here it is, two anterior cerebral arteries, they both come, right? And both of them, they will start traveling into, you remember there was longitudinal fissure, right? So from the front, if you watch, so that was This is one cerebral hemisphere, and in between what was there was the longitudinal fissure, right? This was the longitudinal fissure. So it travels into that, right? It travels into that. But still, we are waiting for that NTA communicating. Both these anterior cerebral artery, right and left, they connect via this small communicating link, and that is none other but it is anterior communicating artery, right? So that's how all the things are, say, positioned. Okay. So here it is, everything good, right? Anterior cerebral, middle cerebral, anterior communicating, all fine, right? So here it is just another view that here this is middle cerebral artery, right? Middle cerebral artery, and that's how, say, this one and this one, they are anterior cerebral artery, and in between there would be anterior communicating artery. Now moving on to the vertebral part, right? This part we already know. This is vertebral. This one is vertebral. They both combine together to form what's called as the basilar, right? Now I'll draw a small figure. It will make things much better, right? So see, vertebral, it forms basilar, right? And then once again they will divide, right? They will divide. Now there are two sets of arteries. Now we are talking about cerebellar, right? So cerebellar, one here, one here, one here, one here, and one here, and one here. How to name them? This is superior. This one, these two are inferior. Right. One is emerging from vertebral, one is emerging from basilar, right? This one is also from basilar, but superior is separate, inferior group is separate. In inferior group there are two, so we'll call this is as an anterior and this one as posterior, right? And they are cerebellar. They are cerebellar, right? So let's pick first. So here it is, one branch, right, which is coming from the top, and it is this, right? So we'll say that this one will this, right? Above one is bit higher, right? So over here, this one, because in this normally it is a paired structure, over here it is only on one side, right? On opposite side it is absent, but doesn't matter, right? This is anterior inferior cerebellar artery. Anterior inferior cerebellar artery. Cerebellar, right? This is cerebellar. Similarly, you can watch that there is one branch over here. See the way it is coming out, right? Coming out. So that is posterior, again, inferior cerebellar artery, right? So we have got anterior inferior, posterior inferior cerebellar arteries. So this one set is done. Then all those, there are some small branches, right? There will be some small branches, they will be coming up. They all are small branches to pons, right? So they are for pons. Right? So all these small branches which are coming out, right, they are for pons. There is another artery which is seen. This is labyrinthine artery. Labyrinthine artery. Labyrinth. right? That means it is for inner ear. Posterior communicating artery is a branch of internal carotid only, right? See, that's what I was telling. Internal carotid, right? Then this is continues as middle cerebral artery, right? It gives one branch, that is anterior cerebral artery, and it gives one branch, this is posterior communicating artery, right? And we draw this thing as thick so that we know that internal carotid is continuing as middle cerebral artery. Fine. Okay. So that is this one labyrinthine. So far, good. Over here, these top vessels, right? That is superior cerebellar artery. So this one is superior cerebellar artery. So that's how they go down. But what is happening? This one is what? This one is basilar, correct? That is basilar. So this basilar is now ending up in what? Basilar is dividing itself in 1 and 2. And this one is posterior, right? It is posterior cerebral, right? It is posterior cerebral artery. Right? That is terminating branch. So done. The entire sequence is complete because this posterior cerebral that would be communicating with this is what? This is middle cerebral. Right? We can write it in short. Middle cerebral artery. In between, here they both are talking. So this is what? This is posterior communicating artery, right? Similarly on the opposite side, right? And then this is which is going up, that is anterior cerebral artery. Both anterior cerebral artery, they are meeting with anterior communicating artery. So anterior cerebral, anterior communicating, anterior cerebral artery, then over here middle cerebral artery, then continuing with this posterior communication artery to posterior cerebral artery to basilar, and then again on the opposite side. So this entire circle is complete, and this is what is called as the circle of Willis, right? This is what is called as circle of Willis. See, seen much better, right? And all good. Say this is anterior cerebral artery. In between they both are communicating, that is anterior communicating artery, right? This one would be the middle cerebral artery, and this which is communicating, see, this would be the posterior communicating artery, and something which is going all the way like this is what? This is posterior cerebral artery, right? Posterior cerebral artery. And the nerve which you are watching, yes, just from the location immediately near optic chiasma between two cerebral peduncle, and it is cranial nerve 3, right? Oculomotor. Very nice. Right? So this posterior cerebral artery, it would wind around cerebral peduncles, right? Because here are cerebral peduncles. So it winds around cerebral peduncle. See, right? So all good, right? The complete system, everything you can watch in this. So I think I'll keep this image as for the practice, because see, this is anterior cerebral, then this is the internal carotid. See, nicely it is appearing, right? Then it continues as middle cerebral. This is posterior communicating. This is even anterior communicating is also seen nicely, right? This is anterior communicating, and then this would be the posterior cerebral artery, and these are superior, right? These are superior cerebellar artery, And this is the basilar, and those small arteries which are coming out, they are all for pons. Awesome, right? And this is our cranial nerve 3, right? All good. And this is optic chiasma, right? This is optic chiasma. So let's remove all everything. Clean. Okay. So this would be for your practice. That one would be for the practice. Okay. Right. Seen nicely. Almost everything you can watch. Now see, this is related to brain. Till this point, we have isolated the things. Now let's add brain to that. Right? So here, this is brain plus arteries, and rest of the structures, they have been removed. Also, say just in this much area, right, this much area, you can see that even the arachnoid has been removed. Right? The entire layer, right? The entire layer, arachnoid layer, that is removed, right? With all those small vessels. Purpose? So that we see that this structure bit more properly with respect to brain, right? With respect to brain. So here it is. Now the brain is present. So see, this one is optic chiasma, and immediately we find that this one is an internal carotid artery. Right? They can be seen. One thing you'll notice that in this case, right, the basilar artery is a bit tortuous. As such, it is straight, but well, again, this is like a normal variation. But important is, this is what we really want to see. Those anterior cerebral artery, right, the pair, see, they are traveling into that longitudinal fissure. So let's see this. Here it is. See, they are traveling into that longitudinal fissure. Right, this one is the longitudinal fissure between right half and the left half of cerebral hemisphere. Right, so that is what is traveling inside. Say this joint, it is anterior communicating artery, right? And this one is anterior cerebral artery. You know it well. Okay. That's where it travels, right? See, that's where it travels all the way. This one is basilar, right? These two are vertebrals, right? And then those small branches which are coming out over here and here, well, it has to be, we said that there are two sets, right? Superior cerebellar and inferior cerebellar. So these are inferior, but they are emerging from vertebral, so they will be posterior inferior cerebellar artery, right? So that is posterior inferior cerebellar artery. Our basilar is bit off center, right? And those superior cerebellar, they are emerging. See from here, this one is superior cerebellar artery. Right. Now the basilar divides into posterior cerebral, right? And that's how the entire brain is divided. So putting it into very simple words, see, that was the internal carotid artery, right? It gave a branch that was anterior cerebral artery. It continued itself as middle cerebral artery, right? Then it gave one that is the posterior communicating artery. Right? Now same thing happened even on the opposite side. So it went like this, right? So this one is anterior cerebral artery. Between both of them, that is the anterior communicating artery, right? This is anterior communicating artery. Then this is middle cerebral artery. Internal carotid artery is continuing itself as middle cerebral, so we are just making it big thick so that we know it, that that's how it would be going, and it will give posterior communicating artery. Done. That's it, right? This much is done. And the opposite side, here comes the vertebral, here comes the vertebral. So these vertebral, they will give one branch, right? They will give one branch. So that is posterior inferior cerebellar artery. Then it will form what? It will form the basilar, right? It will form the basilar. If it is forming basilar, so then one more branch would be given, but this time this is anterior, right? So this was posterior inferior, this would be anterior inferior cerebellar artery. Okay, it moves further, divides into two parts, right? Just a minute. It moves further and divides into two parts, right? And that is posterior cerebral artery, posterior cerebral artery, right? Good. And then over here something given for pons, then one labyrinthine artery, and then those superior cerebellar artery. Done. That's what we watch it over here, right? And this is what is called as the circle of Willis. Now, if we really want to see that where exactly they really go, these anterior cerebral artery, where exactly they go, right? So this is the portion which we are talking about. Let's slice the brain, right? We slice the brain and then we rotate. So it is like when we'll rotate it like this, we'll actually see the medial surface, and that is where only one artery is traveling. So we'll know that where exactly it is going, so that we don't have to really cram that where it would really supply, right? So here it is. So that's our anterior cerebral artery. It is this, right? So see, one here, right? They both join together. So this is anterior cerebral artery. This is what corpus callosum, which was joining both the half of the brain. So this is corpus callosum, right? And that's the range, that's where it is supplying all the way, right? So let's change the color and we mark it that all the way it is this portion that is getting supplied by anterior cerebral artery, this portion, right? So that's the portion on the medial aspect, right? This is medial aspect, but the thing is the brain is in 3D. This is medial aspect, so there would be lateral aspect also, right? So if we really draw the lateral aspect, right, the lateral aspect, this is anterior, right, because of that lobe. So this portion, and this is anterior structure, right? So this would be the portion. So in other words, this is medial and the lateral. So it is the whole wall, right? Whole wall in 3D, right? On the opposite side. So it would be covered like that. So that's how this anterior cerebral artery would be working. See over here. Now we move on to the middle cerebral, right? This one is middle cerebral, right? I hope you are oriented properly. This is middle cerebral artery. And we are talking about lateral cerebral fissure, right? We saw that there was one fissure, right? That longitudinal, which was dividing the whole brain into two parts, left and right. And this fissure. This is the lateral cerebral fissure, which is dividing the temporal lobe from the anterior one, right? Or the frontal one. So here we are dealing with lateral cerebral fissure. Okay, that is where this middle cerebral artery would be traveling, right? So that's why we just pull it and we see that yes, it is traveling all the way, right? So this would be the path, right? That is where it would travel. So in that case, where it is traveling, then it will give the branches. So it is this portion, right? This portion, that would be by middle cerebral artery, right? It is cerebral artery. Fair enough. Okay, now see, there is one left out, which is posterior cerebral, right? So here was anterior cerebral artery, which was going into that longitudinal fissure, right? Then this was which was going into, then that was middle cerebral artery, right? And then this divides, and this one is posterior cerebral artery, right? It is the terminal branch of basilar, right? So basilar now divides. That's how we really see it, right? So this one, this is the same structure, right? So this is our all-time favorite anterior cerebral artery, and that's what we talked about, right? They are distributing above this lower portion, right? That is, and see, this is what, this is cerebral peduncle, right? Cerebral peduncle, you know? This one is corpus callosum, and this is the artery, this one, that is posterior cerebral artery, right? And it supplies the lower portion. So when we really draw it, that is from the medial aspect, right? From the medial aspect, it is this entire portion, right? That is what it would be supplied, right? Okay. Now we move on to the next portion, and this is like, these are the arteries which are outside cranial cavity. When we are talking about outside cranial cavity, right? Outside cranial cavity, that means only one thing would come in our mind, and that is external carotid, right? So this is where we left off. This was the subclavian, this was vertebral, this was common carotid artery, right? And then we elaborated on that, right? Because we sacrificed what? We sacrificed that thyrocervical trunk, right? Where was it? Here is the small portion, right? That is thyrocervical trunk. And because it is trunk, so immediately we'll be giving few branches. So here there are 3 branches. So this one, which will be going for lower lobe of thyroid. So this is inferior thyroid. So this is inferior thyroid, and we'll trace it and we'll find that, well, that something would come up in that, right? And then these two, this is the transverse cervical, right? And the suprascapular, right? And one which is going down, right? This one, that is what? Internal thoracic, right? Internal thoracic. So here, for subclavian, internal thoracic, right? Then, yeah, yellow color, right? Internal thoracic, thyrocervical, and the deeper was vertebral, right? Deeper was vertebral. So that's how we said V then, right? So V, I, and T. V, I, T. Vitamin C and D. Costocervical and dorsal scapular, right? We talked about it. So it is the scalenus anterior. This is the muscle, right? It is the scalenus anterior, and all these first part of branches, these are before scalenus anterior. Crystal clear, right? Now we go for that inferior thyroid, right? So because these are the branches which are related to upper limb, so that is fine. Now here it is that inferior thyroid, it has emerged, right, and it is going right from thyrocervical trunk. Remember, this inferior thyroid, right, is branch of thyrocervical, TC, and it gives one branch, this one. Before it proceeds for the lower pole of thyroid, right, this goes for the lower pole of thyroid gland, right, it gives one branch above, and this is what is called as the ascending cervical. This is ascending cervical artery. This one was transverse cervical, right? This was transverse cervical, and then this inferior thyroid goes, right? Well, again, this you can use for practice, right? Because so many branches they are seen, and all these practice things, don't do it immediately, right? Do it after some time, so that you would be able to recollect the things better. Okay, and let's proceed further. Right now we go high. This is neck, right? And over here, the muscles which are not present, sternocleidomastoid, right? All time we are sacrificing him. Then internal jugular vein, because that is not the topic of the day, and the parotid, because it is a big gland which usually covers everything, so we have removed that. Structures which we know now immediately, and that is this one, right? Digastric posterior belly, right? Digastric posterior belly, right? We know it. When we know that, so immediately the second muscle, right, which will be passing through that sling, that is stylohyoid, stylo-H, that is stylohyoid muscle, right? And this is what, this one is external carotid artery, right? This one is internal carotid sinus, right? That we have talked about. So this is external carotid artery. Now this external carotid, we just cut it and we trace it up. We trace it up. See, it is going all the way, right? That's how, this is where it is going all the way, all the way, all the way, right? These are the two terminal branches. Okay, but this is not the way we want to see it properly. So let's dissect it further. So zoomed version, right? This is zoom, and now the focus is only on external carotid artery, only one. So that's the external carotid artery, right? This one is the common carotid artery, right? The first branch which is coming down, and there is, here is what, here is thyroid, right? So supply for thyroid is coming from top. There was already one artery, inferior thyroid artery, right, which was from that thyrocervical trunk. Thyrocervical trunk was from subclavian, right? So we'll name this thing as superior thyroid artery. So that was easy, right? And it will go to thyroid. So this is Superior thyroid, correct? Superior thyroid, because now we have taken our camera up. So this next, she is lingual artery, right? Lingual artery. Lingual, that means it will be going for the tongue. Very right, right? It will be supplying the tongue. And who was the big boss muscle of tongue? Hyoglossus. So yes, it has to pierce. So it will pierce hyoglossus. G, right? Hyoglossus. Where is that muscle? Here it is, right? And see, that's how it will pierce, and it will go towards the base of the tongue and it will supply, right? To reach to this point, yes, we have removed posterior belly, digastric, stylohyoid, all those things have been removed, right? You have already understood it from the top portion. Okay, let's dissect still further, right? Now to completely removed, right? The digastric and the styloid muscle and the process completely removed, so that we can really see all branches very properly. And yes, the branches which we already know, this is internal carotid artery, this is common carotid artery, this is external carotid artery, this one is superior thyroid, right? Superior thyroid. I'm not writing arteries, right? This one is what? This is lingual, right? This is lingual. So one by one, we have to just settle what is missing, right? What new things are coming up. This is drawing our attention, right? This one. So it is going, see where it is going. Let's trace it. See, it is going on the occipital side. So I will name it occipital. This is occipital artery. And then there is one artery over here, right? Let's take that also. So this is what? This is angle of mandible, right? Because that's the area. This is angle of mandible. Angle of mandible. And this one will be giving supply to the face, right? So it is facial artery. Facial artery, right? So we now know so much. Superior thyroid, lingual, facial, occipital. Still there is some jungle on the top, but it will come, right? So here, let's follow the facial one, right? This is the facial. So this facial artery, it goes between two things, right? And then it emerges, it goes deep and then hidden, and then over here it emerges, right? See it emerges from here, right? Or I write like this, emerges here, right? And then it has got all the tortuous course, right? It is moving further. So in that case, this, see this tortuous course, right? All the way then it is going, right? And it will supply, right? We said that it is face, right? The lower part of face will supply lower part of face. So that's how it really goes. Meantime, again this is superior thyroid, right? This one lingual and this one occipital, right? And we are talking about facial, right? This is facial. Let's move further. Now this is facial, this one is lingual, right? All the branches, use it for practice, right? Use it for practice. So that we use one over here. Yeah, no, I think here only, in this only I have to write. ठीक. Chalo. This one is occipital, right? This is occipital. See, it is going on the occipit side, and this is going underneath, right? When it is going underneath, this is splenius, right? So this is splenius, and it is going underneath all the way, and then as you follow, see here it is, all these arteries goes underneath and then travels over here and then appears, right? Then appears. So this is where it supports posterior part of skull, right? So it re-emerges over here and supplies posterior part of skull. Fair enough, right? Here it is, right? All the way it supplies to the posterior part. So this is what we are dealing with, the occipital, right? See the tortuous way, all the way it supplies. Okay. Now see, in this, there is one more interesting branch. This is fine. That's occipital. Okay? This one is occipital. And this one was lingual, and the superior thyroid was below. And this main artery, though it is in continuation, it is going all the way. But here it is. Here is the small branch, right? Small branch. It is going behind the ear. Going behind the ear. That is the auricular. So posterior auricular artery, right? And it would supply the scalp behind ear. It would supply the scalp behind ear, right? How interesting. So there it is, right? We can see that, right? The posterior auricular and the occipital, right? So we'll just write occipital, and this one is posterior auricular, right? Now next is to see one very interesting, very small branch. We need to cut both of them. We cut both of them and see a small branch, right? This one, that is ascending pharyngeal. This is a deep, right? Deep branch, and this is ascending pharyngeal. At this point of time, even if it is, if you can't remember all the branches, no problems, right? Just be comfortable that okay, this is how the branches are. Then just in 3 pages, right, we'll go for a grand revision and you'll be able to remember everything, right? So this is ascending pharyngeal artery. Pharyngeal, so it will go for pharynx, right? So yes, it will supply upper part pharynx. Now to this branch, right? Now see, we are almost at the highest part of now external carotid artery, right? And this highest part, this is where there would be, say, parotid gland, right? So we have removed the parotid gland fully, right? We have fully removed it. So that's why we can see the branches clearly. But otherwise, do remember that this is the area where you will find the parotid gland, right? Parotid is over here. Parotid here, right? But removed, right? So that there is no confusion, as none of the parotid traces they are seen. Okay. Now here is the branch, right? One branch we saw facial, right? And this is another one which is coming up, right? See, from here it is going, it is transverse facial, right? It is transverse facial artery. Then this big one, right? It is big one. We feel कि okay, bas ab to khatam. This must be the last branch, right? Maybe, let's see. right? But it is branch. See, main trunk is going, still going, and this is a branch, okay, but a bigger branch. So this is superficial, superficial temporal. That was the area, right? We never talked about till this point. So this is superficial temporal. Now this superficial temporal, here it is, right? That's superficial. Over here, what would you find? You'll find that zygomatic arch, right? That would be the zygomatic arch. And from here, this is all superficial temporal, right? It is going above. And this is in front of external ear, right? Here it is. That's where, so that's why we replace that ear also. So this is because this is the keyword, in front of external ear, right? This is in front of external ear. And then it would go all the way up, right? Superficial temporal, right? This is within, say, superficial temporal fascia. All these areas, they are covered. So within superficial temporal fascia, right? Temporal region, it is there, and that's where it will handle. Fine. So the entire upper and lateral areas, all those areas, they are handled. Now we just pull that superficial temporal, right? And we were thinking that bus was khatam up to, right? Superficial temporal artery, right? That's what we are pulling on one side. There was, over here, there was one branch, right? Which was that? That transverse facial, correct? Transverse facial artery. But that we have already cut, right? We have removed. We see something so big, huge one. Yeah, that is the continuation of external carotid artery. That is the continuation, and that is maxillary artery, right? Now it is all good. Maxillary artery. This is the maxillary, right? Just at the mandibular neck, right? This is what is happening. It is getting continued as a maxillary artery. So to see this, right, we have to see this maxillary properly, right? So we remove all the structures whatsoever which are coming over here, right? So whom we remove? See, this is masseter, right? So we'll remove the masseter. Over here, temporalis region, so temporalis muscle, right? So we'll remove this temporalis also. So then there would be the mandible, right? This one would be the ramus of mandible. So we'll remove ramus of mandible, right? Then there would be the zygomatic arch, right? Zygomatic arch, we remove that also. So all those things once we remove, right? See what an artwork, right? We are, friends, into infratemporal fossa, right? So when they say it's so complicated way that infratemporal fossa are just below temporal region, right? And it was bounded laterally by zygomatic arch. We opened the zygomatic arch. Okay. Yeah. So infratemporal fossa, right? Infratemporal fossa, that laterally, what was there? That zygomatic arch. We removed zygomatic arch. So actually what we are watching is straight away infratemporal fossa. And in infratemporal fossa, when everything is removed, the first thing what comes, right? Those pterygoid plates, lateral pterygoid plate, then medial pterygoid plate. So lateral pterygoid plate was giving that muscle lateral pterygoid. Here it is your lateral pterygoid muscle. Here it is, right? Lateral pterygoid muscle, right? And this is the maxillary artery which is traveling all the way, right? That's the maxillary artery. See its range, right? That is the maxillary through and through. And yes, at times it passes through, sometimes it is on. Over here it is on the lateral pterygoid, but it might even pierce also, right? So it is all fine near a structure, so at times they pierce. There are so many variations. Okay, so here is now our focus is on middle meningeal, maxillary artery, and maxillary artery is there, and see how it is spreading, right, at so many places. We are interested in this, say this one, right? I hope you are oriented properly, right? This is what this was, superficial temporal, right? This was superficial temporal going up all the way, right? Then the thin one which was over there, that was the posterior, right? We have cut that. This is middle, very important branch, middle meningeal artery, right, which is a branch of maxillary, early branch of this maxillary. This one is maxillary, so I'm just writing M, right? It is maxillary. So middle meningeal artery, that is one branch. Then you see that there are so many other branches which are going, whose name is now not very, they are collectively called as alveolar branches. They are all called as alveolar branch, right? They are all alveolar branches. Plus, there are few arteries which have been cut. They are for the muscles. So we can say for muscles of mastication. So when we say it like this, it would actually complete the whole responsibility of the maxillary artery. But this middle meningeal artery, this is very interesting, right? So let's see where it goes. This middle meningeal artery, it goes up, and here it is. During our discussion of skull, we said that there is foramen spinosum, right? Foramen spinosum, that is where. This is foramen spinosum. See, on the first day I told you that you don't have to cram, right? You'll start remembering what are the structures passing through these foramen automatically. Right. Here it is, foramen spinosum, right? And this foramen spinosum, let's see from the inside, right? This is outside, this is base, right? See the teeth, right? So this is base of the skull. So let's see from inside. All this decoration, right? This is inside, and this one is foramen spinosum, right? That's foramen spinosum. And when this middle meningeal artery it comes, it starts dividing. So all these nice decorations, they are all thanks to grooves created by middle meningeal branches, right? So these are the grooves by branches of middle meningeal artery. Middle meningeal artery, which is a branch of maxillary, which is like a final continuation of the external carotid, right? External carotid, which is branch of common carotid, which is emerging from brachiocephalic, that is on the right side, and that what is emerging from the arch of aorta, right? And that is from the left ventricle. Okay, now see, this middle meningeal artery, it runs within the thickness of dura, right? So that's where you see, right? So dura thickness. So here, right, we see all of them, right? Very proper. See middle meningeal, then all those alveolar, etc. There is one branch. See, this is middle meningeal, right? Early branch, so that we identified it. Then this is maxillary. It is going all the way, giving all those chota alveolar branches to muscles, etc. but still it is continuing all the way, right? And one branch and going still up. So now to this is limit. It is going where? It is going to orbit. This is infraorbital artery, right? This is infraorbital branch, and name itself is telling, so it will be going through inferior orbital fissure. See the strike of this range, right? This is maxillary and it is going all the way, right? And see, there is one branch which is going like this. Now, this is interesting. Where should it go? This is the last and final, right? Actually, last and final, right? So this one, this is the branch which will go into via the pterygomaxillary fissure, right? Pterygoid and the maxilla, back of maxilla, in between there is gap which is called as pterygomaxillary fissure, right? That was where the in the deepest part there was foramen rotundum, which we tried to see from the orbit, right? So this is where it goes into pterygomaxillary fissure, and that's it. From here it will go all the way, right? It is now this pterygomaxillary fissure, so it is just above, so there is nasal cavity and the palate, so bas that's it. Nasal cavity plus palate, that's what it really supplies, and over, right? So this was the entire game of all the arteries of upper limb, right? Now let's revise it. Just within 5 to 7 minutes, you'll be able to remember everything, right? It is like as we'll speak, those pictures will start appearing in front of you that yes, this really happened. It really happened like this, right? So we'll take the help of brain mapping, right? Brain mapping is we'll write only the keywords, no lengthy descriptions. So here is, now we are dealing with those arterial system or the arteries. That means our first thing, subclavian artery, right? And then we do have that internal carotid artery and then external carotid artery. We separated internal carotid and external carotid because external carotid is for specific purpose, internal and this they will be working hard, right? Here it is, because here it will be giving that vertebral artery, that's right. So we'll be taking care of that vertebral artery. Internal carotid to herself will be taking part of it. So thus both of them, they will be forming that circle of Willis, right? And here is the external carotid, which will give lots and lots of branches, but we'll summarize all of them onto one single page, so that would be easy, right? Let's start. And just for the reference, right, as such, so I know this thing is very clear to you, but left ventricle, this is brachiocephalic trunk, goes like this, this is subclavian, this one is common carotid artery, over here common carotid artery on the left side emerges directly, subclavian emerges directly, right? This is on the left side and this is for the right side, just the reference, right? Now on the full page, right, what we are now watching is our subclavian, right? So this subclavian we draw big, right? This is what? Thyrocervical trunk, right? This is thyrocervical trunk. And we said no, VIT. So first one was that vertebral, right? That vertebral, that was the artery, right? So let's draw it like this, vertebral. So this is V, vertebral. Then I was what? I was that inferior thyroid. Yes, inferior thyroid. So let it go for that thyroid. So this is inferior thyroid, right? And this is TC, thyrocervical trunk. So done, thyrocervical trunk. Now for thyrocervical trunk, we change the color. Thyrocervical trunk was giving what? It was giving those two branches, right? One was transverse cervical, right? One was transverse cervical and another was suprascapular, right? So that is done. What else? Over here, over here, let's go for that circle of Willis, right? Very quickly, this is, we draw like this. This is internal carotid artery and it would be continuing itself as middle cerebral artery, so that we draw it big. It gives one branch. This is anterior cerebral artery, right? Then it gives one. This is posterior communicating artery, right? Same thing would happen on opposite side, right? Same thing happen. This is internal carotid artery and this one would be middle cerebral artery, will give this posterior communicating artery. This is anterior cerebral artery. So both of them, they will join, right? So that would be anterior communicating artery. This one, this one. So that is how the communication is done. Now change color. This is there space? Chalo, koi baat nahi. Right? Vertebral artery would think such an injustice, but can't help. Right? So this is vertebral, vertebral, moving on to the basilar, then one branch from here and one branch from here, right? They will be those inferior cerebellar, right? Inferior cerebellar, right? Cerebellar arteries. One is anterior, one is posterior, right? So anterior inferior cerebellar artery, posterior inferior cerebellar artery, and boldly straight away we take basilar, divide into two parts, right? And this is what, see, anterior cerebellar taken, middle taken, so it has to be now posterior cerebral, right? It is cerebral artery, because from here there is one more branch landing on, and that is superior cerebellar, right? Superior cerebellar artery. Bas baki to all chota chota, right? They are like pawns, right? We are drawing pawns branches as if chota chota. It is so important, right? But well, and finally this one, right? This one, that would be the labyrinthine, right? The name is good, so that's why. So labyrinthine, right? Labyrinthine artery, and that is for inner ear, right? Done. This is circle of Willis. Now, interestingly, I tell you one thing, that see, this is why such a beautiful system. This circle of Willis, it is so easy to say, okay, why such thing? The backup circulation, right? It is for collateral, right? It is easy to say that it is for collateral circulations. But remember one thing, this collateral circulation is of no use in case of accidents or something which is happening instantly. It is okay when things are progressing slowly, right? So then all those collaterals, they develop. But it is not so that if there is any stroke and if one part of the brain is not getting blood supply, then immediately these collaterals open. No, right? Nothing like that. This is only for slow developing disorders, when this thing can help. Okay, only one thing which is left out, and that is our external carotid, right? We'll draw it. So here it is, right? This is external carotid artery. First thing first, right? It landed one, that is superior thyroid, correct? Superior thyroid artery, and which went to the superior pole of thyroid and done. And then there was like this, that was lingual, correct? Lingual artery, you remember, it was going towards the base of the tongue. And then we said that, okay, one which is going posteriorly, and that went to occipital, right? And then on the back side, right, it took there. And then there was just behind the neck, just behind the ear, there was one more. So we said that it is behind the auricle, so posterior auricular artery, right? And then we sacrificed both of them to find out that there is one small branch, right? And that was which was going for the upper part of pharynx. So let's draw it in different colors to know that it is deep. So it was ascending pharyngeal, right? Ascending pharyngeal artery. So that portion is done. Back to our main color. Sorry. Then over here, straight away going for the lower part of the face, facial, right? And facial reminds us that there would be one more, which would be transverse facial, right? So it was transverse facial. Now, once the transverse facial is done, there was one which was going all the way, all those tortuous, and that is superficial temporal, right? For the temporal region. That is good. Superficial temporal. And bus now to then this continues as maxillary, right? This is the main maximum or the maxillary. And this maxillary will give one branch, that is middle meningeal artery, right? And then it will be giving those branches like say alveolar branches, right? And then the branches to the muscles of mastication. But this artery itself would pass through that pterygomaxillary fissure and will end up supplying nasal cavity plus palate, right? So we write it like this is how it will end up done. So that's it, done, right? So this was, and literally, right? So artistic, right? Such a beautiful pattern, the entire head and neck, all these branches, these are the all main branches. Now tomorrow what we'll do is, this was the arterial system, correct? Tomorrow we'll take the venous system. And in that venous system, again, like today, we'll be taking, tomorrow it will be still more important because we'll be talking about venous sinuses. Actually, we'll be talking about venous sinuses plus obviously rest of the veins, etc. Right? All those things will come. But these venous sinuses, they will be like our chief guest. Right? All right. So, thank you so much. And see you tomorrow. And thank you for everything. Thank you. Bye-bye and good night. And I'm saving this file so that I put it into our shared folder. Right? Thank you.